This is Dr. Nyla Fleming, and welcome to my review on developmental milestones from birth to 12 months. The reason that I've chosen to isolate this portion of your learning material is because this is an area where I find students struggle. It is also an area where your patients' parents will have the most questions, and you will have to do quite a bit of anticipatory guidance on this age group. So we'll begin with newborns and we'll focus now on birth to 1 month. In the newborn period, it is completely normal that a baby will have a loss of 5 to 8% of their body weight. This should rebound very quickly, and you should notice in weight gain of 0.5 to 1 ounce per day. Sleep is also a big question that parents will have. Expect a newborn to sleep about 16 hours per day, and they will feed every 2 to 3 hours. Another question that you will likely see on future board examinations, so hint, hint, and you'll be asked this question quite a bit by your parents, is how much to feed their baby. So the math breaks down to 110 calories per kilogram per day should be enough to support a growing infant. I've included a hyperlink here to the CDC. I absolutely love the CDC, especially for things such as developmental milestones and educational things for parents and clinicians. This page takes you to a website that covers infant and toddler nutrition. Parents that are bottle feeding their baby, that will break down on that math to about 1 to 2 ounces per feeding in the newborn period. But again, this is an excellent resource and there's so much information there. So definitely go back and review that site. And we'll continue on with our brand new newborns. And look at this picture. Babies are so cute. So I've included a lot of pictures of babies just because they make me smile and they bring me so much joy. When we look at the social and emotional development of a newborn, things that they will find soothing will be eye contact, singing, and touch. So those things will be soothing. You will also notice that the new baby will quiet and turn towards their parent's voice. As far as cognitive development goes in this period, you will notice that the hearing is well developed and the baby can briefly focus on a bright object that is held about 8 to 10 inches from their face. Let's move on to 1 month to 3 month olds. First, we'll look at physical development. Babies are growing continuously, so they should be growing about 1.4 inches per month. And we're back to that weight gain. Remember, it's 0.5 to 1 ounce per day. Sleep and elimination will become more regular. And you may notice that kids from 1 to 3 months are fussy, and that's because they're growing so quickly. Next, we really look closely at motor development in this age. When it comes to motor development, sometimes students struggle with this, and what I want you to remember is that it's the big gross movement before it comes down to the fine movement. So you'll definitely see things like this on your board examinations or be asked these types of questions in clinical. So in the beginning, the infant will try to grasp an object. So before they move on to grabbing things with their index and thumb, they're going to try to just grasp something. So just remember, there's always a stepwise approach to the developmental milestones. As far as head movement, they should be able to lift their head about 45 degrees, and you will notice that there is symmetrical body movement. So they're not just moving one part of their body, they're able to move both arms, not just one. Communication at this age will be cooing and babbling. Social and emotional development is they will begin to imitate the parent's expression. So you'll start to see a social smile. And you'll see that in this picture of the 2-month-old who begins to smile at people, which they're being social. As far as cognitive development goes, they will visually track toys. They will show excitement when those toys come into view, and they will also respond to sound. So here are some images. We're looking at a 2-month-old who is trying to look at mom. And we're also looking at another 2-month-old who is paying attention to the faces that are coming into her view. And again, this is coming from the CDC. The CDC is an excellent site for these types of things. Now let's look at 4 to 5-month-olds. Physical development. We will see more regular sleep patterns. This is the age where baby begins to sleep through the night. And birth weight should double by 4 to 6 months. Motor skills. The primitive reflexes begin to disappear. I won't digress and get into primitive reflexes, but I do recommend that you review those. And again, this is something that you will likely be tested on both in the classroom, in your clinical, and on future board examinations. Children will begin to reach for objects at this age. Also start looking for rolling. So they will roll back and then to front. They will begin to learn to sit. They will learn to get into like the tripod position. They can also bear full weight on their legs with assistance, of course. And this is the age where they love to bounce. So lots of bouncing up and down in your lap at this age. Communication will still be more babbling. There'll be cooing. There'll be laughing. And oral motor development is more intentional in this age group. Socially, they will begin to smile spontaneously and they interact more with their parents. And again, another cute baby. Cognitive development is visual exploration and mouthing behaviors. At this time, it's okay to try to introduce some finger foods. You will also notice that I believe the CDC says 6 months is their recommendation, but you are able to start introducing some things in this age. Definitely things that are not difficult to digest, and definitely no choking hazards here. So that's a big thing. Again, pictures because babies are cute, and again, sometimes the pictures are good ways to get things to sink in for my visual learners. This is an image of a baby smiling spontaneously. And at the age of 4 months, you will clearly know when baby is happy and when baby is sad. So our picture on the left, baby is not sad, but when dad comes and picks up baby, he's now happy. Other things we look at is, remember I mentioned about the motor development. So at this point, baby begins to use eyes and hands together. So you can see a 4-month-old reaching for a toy and will also reach for that toy possibly with one hand. These are normal during this age range. Next, we'll move on to the 6 to 8-month-old, and this has got to be the cutest 6-month-old I have ever seen in my life. I'm sure right now he's much older and terrorizing his parents, but right in this picture, this is the cutest picture I've ever seen of a 6-month-old. So let's look at our communication and language in this age. They begin to make specific sound imitations, and their receptive language increases. There is social and emotional changes at this age. They begin to have some social play. They may use gestures, and they also start to notice the difference between a stranger and someone that's familiar with them. So you will notice in your exams that maybe your baby's a little more hesitant when you go to examine a 6-month-old, and that is completely normal. These are images of expected behavior in a 6-month-old. You will see baby bringing things to her mouth. They begin to pass things from one hand to the next. So remember in your previous pictures, it was grabbing with one hand. So now they're grabbing with one hand and moving on to passing things to the other hand. And at this age, they also start to show curiosity for things that are out of reach. So this is the age where kids start to reach, and you got to make sure you give the parents some anticipatory guidance about falls. Additional pictures here. Baby knows someone that's familiar, and you see the look on the right. Baby's like, oh my God, who is this lady? And this is the look that you will get in your clinical practice, when you go to examine a 6-month-old, they'll kind of give you that look like, oh my God, who are you and why are you touching me? Let's move on to 9 to 12-month-olds. Physical development, you will start to see more growth spurts with periods of slowed growth. Bowel patterns will become regular, and the kid's going to have some food preferences. Communication, patty cake and peekaboo are hits in this age. Kids enjoy songs. They're able to say 3 to 4 words. They can look at an object when it is being named and follow one-step request. And just remember that this is 9 to 12 months. So it's not saying that at 9 months that every child will be able to say 3 to 4 words. It's giving you a range, and this is between 9 and 12 months, and this is on average. You will also notice a change in motor skills. So now kids are able to hold and play with an object. They can sit for a little bit longer. You'll start to see crawling. And again, remember with motor development, you will progress. So the child will go from standing to walking, and they can begin to use their finger to point at specific objects. Again, cute kid. So I had to put her in my slideshow. From 9 to 12 months old, we'll see some cognitive changes. They are able to complete more complicated tasks. They may draw with a crayon. Play can become more spontaneous and self-directed. Here are some images of children at play. So the 9-month-old in this picture is able to grab some serial O's between the thumb and the index finger. And they are also able to point at very specific objects. And here's a kid playing peekaboo. And at age 1, they will also have favorite things. I think we have all had this experience with either your own child or someone else's child. You're like, oh my God, it's time to go. And they will not leave without their favorite object. And in this picture, I'm not exactly sure what this is, a koala, a panda, something. You'll find the exact same thing in children. You'll have no idea why they love a specific object, but it is their thing and they're not going any place without it. I want you guys to focus on the timing of milestones. Look at them in the big picture instead of being 100% concrete with things. So there will be a range of what is normal. So every child won't hit a developed milestone at exactly 4 months. There's a 4 to 5 month range. So make sure you understand that there is a window of opportunity for the progression. And if you look at this slide that I have here, you will notice there is a definite progression of coordination, of progression of your milestones. So you go from sitting to standing to crawling to walking. So there's a progression, and make sure you keep that in mind when you are tested on these things. Just look at the progression and you can kind of figure out where kids will fall. And another thing that I always warn my students and parents about is that every child is not going to progress exactly the same. There will be some children that are walking at 6 months, and that could be normal for that child. That doesn't mean that your child is abnormal because your child is not walking at 6 months. That is because that child, for whatever reason, developed in that skill earlier than what your child did, and that does not make your child abnormal. So it's important to look at the developmental milestones according to how they are written versus the experiences that you've had with other children. And again, this is another layout of the developmental milestones, and definitely take some time to review these. And again, just remember it is a progression. And even when we look at the fine motor skills, you grasp with your palm before you begin to grasp with your pincher fingers. Back to my favorite CDC for milestone trackers, there are apps that you can develop, that you can download onto your phone. The CDC also provides handouts for you and handouts for your patients. So definitely take a look at these. I mean, there's checklists. You won't have to memorize everything. Um, just use the CDC. They are absolutely fabulous. Hopefully, this has been very beneficial to you. If you have any questions, feel free to reach out to me. You guys know how to reach me. Take care.